Hi, I'm Dr. Tahiliani, a consultant dermatologist from Mumbai, and I'll be throwing some light on atopic dermatitis. Atopic dermatitis is a non-communicable, common and often persistent skin disease that affects a large proportion of the world's population. It usually begins during infancy or childhood during the first 5 years of life, though rarely it may begin during adolescence or adulthood. Patients with atopic dermatitis have super sensitive skin and a low threshold for irritation. The skin is extremely itchy and inflamed, causing redness, weeping, crusting and scaling, and over time the skin becomes dry, thickened and pigmented. Many patients and their families have a low quality of life due to sleep deprivation, anxiety and stress caused by the disease, as well as fear of acceptance from the society due to the unsightly nature of the rash. Most patients tend to have an unpredictable and prolonged course with periods of remissions and exacerbations. The exact cause of atopic dermatitis is not fully understood, but there is an interplay of various genetic and environmental factors. Atopic dermatitis is also closely associated with bronchial asthma and allergic rhinitis, and some patients are more likely to develop these conditions in the future. There is a loss of function of a protein called filaggrin in the skin of atopic patients, which plays an important role in maintaining skin hydration. The diagnosis can be established by examination and inspection by a dermatologist, and laboratory tests and investigations play a very limited role in the management and diagnosis of atopic dermatitis. Food allergens also play a very questionable role, and therefore routine allergy tests are not recommended for atopic children. The following factors are known to aggravate atopic dermatitis and should be avoided: dryness, low humidity, especially associated with cold weather, rapid fluctuations in temperature, woolens and synthetic fibers, harsh soaps and detergents, flowers and pollen, dust and dust mite, animal fur and dander, chemical solvents, cigarette smoke and environmental pollutants. Most patients of atopic dermatitis can be managed successfully with proper medical therapy and a few lifestyle modifications. Intensive therapy is reserved for only about 10% patients of atopic dermatitis who suffer from a more severe form of the disease. Regular use of mild Syndet cleansers and moisturizers is of utmost importance to maintain long periods of remission. Consult a dermatologist at the earliest if you or your family members suffer from atopic dermatitis. Successful treatment outcomes are possible out of a partnership between the dermatologist, the patient, and the family members. Thank you.